big bucks pouring into the pockets of Bay Area doctors, and pharmaceutical companies are the ones signing the checks.
The business of pain, it is a lucrative industry now, but what happens when the treatment spirals into addiction?
In a special Full Circle report tonight, I-Team investigator Kylie McGivern looks at all sides. The doctors defending the payments from Big Pharma and the lawmakers now demanding more transparency.
So I grew up playing baseball.
Middle in. Good.
That was the place where I felt at home growing up. You know, that was my outlet.
In 2006, Steven Sundquist was playing for River Ridge High in Newport Richey.
I was a heck of a pitcher.
It was his junior year when Steven learned he needed elbow surgery.
At the age of 17 years old, I had Tommy John.
After the operation, he left the hospital with a prescription for opioids.
And I was never, made aware of what these drugs were going to do to me, the side effects, nothing like that.
Steven now is a recovering addict.
It got out of control very quickly.
As Steven's addiction began, new federal numbers show opioid pills flooded the Tampa Bay area. 61 pills prescribed per person per year in Pasco County from 2006 to 2012, according to a Washington Post database. 67 pills per person in Hillsborough, and 71 pills a year for every man, woman, and child in Hernando. The I-Team also found pharmaceutical companies promoting opioids, pumping tens of thousands of dollars into the pockets of local doctors in just the last year. Payments for speaking fees, consulting work, and meals.
Let's get underway.
Medical ethicist Art Kaplan says it's all perfectly legal, but those payments to doctors can impact care.
We have pretty strong evidence that's been built up from study after study that payments to doctors definitely influence their prescription practices.
Kaplan says doctors shouldn't accept any money from Big Pharma promoting their pain pills.
When it's opioids in the middle of an enormous epidemic that's killed tens and tens of thousands of Americans, they shouldn't be on the payroll of those companies at all.
But we found one local doctor, Stephen Chun, raked in $270,000 while on the payroll of a disgraced fentanyl spray maker from 2013 to 2016. He ran a pain clinic in Lakewood Ranch. At the same time, he was paid top dollar for speaking engagements on behalf of Insys, a company with controversial marketing practices.
I got new patients and I got a lot of them. If you want to be great, listen to my voice. You can be great, but it's your choice.
This rap video is one Insys made to promote their fentanyl spray. The video was shown in federal court before a judge convicted the company's founder and former execs for bribing doctors to prescribe the fentanyl spray. Although Dr. Chun accepted payments from Insys, prosecutors have never alleged he accepted bribes from the company. Dr. Chun wouldn't speak to us on camera, but told us in a statement, "These speaker presentations had absolutely no impact on my prescribing habits. I have always been dedicated to my patients and have provided them with the highest medical care." Insys declined to comment.
Most physicians are just trying to do the best for their patients.
Catherine Drabiak, a public health professor, says payments to doctors aren't necessarily a bad thing.
This provides physicians up-to-date access to the latest treatments and cures and the latest research.
The hard part, she says, is knowing what's behind a doctor's push for a particular drug.
And how much is that independent judgment coming through, or is it a mouthpiece for the pharmaceutical industry?
So where do patients come in, the very people impacted by these decisions?
In most cases, the physician won't tell the patient.
And that is where State Senator Darrell Roussan of St. Petersburg sees the biggest problem.
We should know whether or not a doctor is on the payroll of a pharmaceutical company at the time he's prescribing pain relief for people.
For Senator Roussan, the fight is personal.
I'm 21 years clean.
He says the law should force doctors to tell patients when they receive a paycheck from Big Pharma.
And I will certainly look at legislation next session that requires this type of disclosure and transparency.
We focused on doctors prescribing opioids, but pharmaceutical companies pay local doctors to promote other types of drugs as well. You can search whether your doctor has received payments from drug makers, and we have a link to this federal database on our website, abcactionnews.com. I'm I-Team investigator Kylie McGivern, taking action for you.